Welcome to BPS Live. This is Steve Ronan. I'm here to entertain you tonight with our new show, which is all about Mommy Makeover. And so it's a very popular topic, and the term was actually coined by a friend of mine who's now kind of semi-retired. So let's talk about what is a Mommy Makeover. Mommy Makeover is typically a combination of breast and body surgery after pregnancies. And so typically what happens with the body is procedures like tummy tuck and liposuction. And with the breast, it'll be augmentation, lift, reduction, or some combination of those things. And so that's what we'll be talking about tonight. We hope you're excited to explore that with us. As always, I'm here with Brette, who's my co-host. How are we doing tonight, Brette?
Hi, doing great. I'm really excited about this episode. We have so much information to share with you tonight. Before we get started, I just want to remind everybody to follow us on social media, where you can see all the latest things we're going to have here at the practice, like before and after photos, specials, and upcoming events. Back to you, Dr. Ronan.
Why would someone choose a Mommy Makeover? Let's talk about what happens with pregnancy and deliveries and children and the ravages they bring upon our bodies. And so typically what happens is, there's obviously a baby there, and that's stretching on your abdominal wall. And for the most part, the wall doesn't entirely recover. It'll tighten up some, whatever it's going to, but whatever laxity is left over is laxity that will be permanent. It doesn't really matter how many sit-ups you do. You can strengthen the muscles, but you can't actually tighten the abdominal wall. And so that's one of the primary things that we focus on with Mommy Makeovers and doing tummy tucks, is actually tightening up the abdominal wall. In addition, many patients after delivery will have excess skin, and especially on the lower part of their abdomen, sometimes on the upper as well. And so when we're doing a tummy tuck, we'll address the skin excess. Also popular with Mommy Makeovers is liposuction. And so that typically includes reducing the unwanted fat deposits, which are pretty typical over the love handle and flanks, the inner thighs, the outer thighs, down the back sides of the thighs, maybe the medial knees. And so when we put together a tummy tuck and liposuction, we're sort of going after or attacking all of those things. So we're working on excess fat, tighten the abdominal wall, and tighten the abdominal skin. With respect to the breasts, there also are all different types of changes with pregnancy, and that may involve breastfeeding. And so typically what happens is during a pregnancy, the volume of the breast grows. And then after pregnancy and with kind of the withdrawal of hormones, there's some shrinking down, or what's called postpartum involution, or reduction in the volume of the actual breast. And that may or may not lead to a little bit or a lot of drooping. Some patients will get bigger and really never reduce in size, and therefore are too big. And so the typical kinds of things that we'll deal with breasts will be a volume that the patient doesn't want, either too small or too big, and then a shape that a patient doesn't like, which would involve drooping. And so we can apply a combination of procedures, which would be an augment or a lift or a reduction, to help patient regain the shape and size that they want to be. So if the volume is too small, we add an implant in order to make it whatever volume we want. Sometimes we'll use fat if we just need to get a little bit of extra volume. If a patient has an appropriate amount of volume but is droopy, then we'll do a lift, which means reshaping the breast but keeping the same volume involved so that it appears higher up in a better shape. And if someone's too big and droopy, we'll do what's called a reduction. A reduction is the same thing as a lift, except we also remove some tissue to make the breast overall smaller. And then the last one that we didn't mention is someone who's too small and droopy, which is one of our most common breast procedures, which would be an augment lift. So we'll put in an implant to adjust to the volume that we want, and then we'll do a lift to build the breast around that implant, lifting it up into place. Something that is not often talked about by most people, but in our office is talked about quite a bit, is the psychological impact of having these breast and body changes on someone. And so it goes from someone that is psychologically damaged or traumatized and is really bothered sort of at the core with these changes in their body. And so it doesn't really matter exactly where you're coming from. We're typically able to help. And so what we'll try to do is to restore your body to either where it was before, in some cases, or sort of like the $6 million man, better, faster, bigger, stronger than it was before, and maybe what you always wanted to be. And so those are the typical types of things that we'll talk about during consultation, is to try to figure out, like, why are you here? What's motivating you? So we can make sure we address those in our plan. We'll sort of attack those areas of concern. But many of our patients really aren't that traumatized or that bothered by it. They just want to regain the body they had before, feel more confident. Oftentimes these procedures are things they were thinking of even before pregnancy. And so we'll talk about and go through all of those sort of concerns during your consultation when we pick a plan for your procedure. So let's talk about that consultation and what happens during your consultation. So first thing we'll do is we'll get a little bit about your medical history and background and make sure that you're appropriate to have one of these types of procedures. That's like one of the first things we'll do. And then we'll also gather all of your concerns. And I have ways of asking questions that sort of test what you actually want. So a lot of times someone will come in asking for a particular procedure, and that procedure really doesn't address what their want or need is. And so I'll sort of tease out what's bothering you through like a series of questions. And once we get all of that out, and I know all the issues that are concerning you, well, then we'll formulate a plan to address all of those and maybe even some more things. And so it's super critical at this juncture in the consultation to find out what you want and provide the right plan. We see patients almost every week that have had a surgery previously that didn't address what their actual needs were. They maybe asked for that surgery and got it, but it never really addressed the primary concerns. And so we will really sort of dig into that and figure out what are the actual things bothering you. And then we'll create a plan to make sure we deal with it, because that gives you the highest chance of having a successful outcome. With each Mommy Makeover procedure, we're choosing the procedures or customizing it for you to achieve the results that you're looking for. Super important with any kind of a plastic surgery is having realistic expectations. And so we'll set those. We want to make sure that you know what the procedures are going to do and what the procedures are not going to do. And so sometimes I'll present multiple procedures and explain those and tell you where each one will get you. And that kind of helps sometimes form realistic expectations in a patient's mind. And so we want to make sure that we do that, and then we match the right procedures for your concerns, have the realistic expectations, and then go and execute that. And that gives you the highest chance of having a successful outcome. Okay, let's talk about the recovery of the various procedures that we do. In general, a breast procedure done by itself is about a week off of work in an office type situation, 2 or 3 weeks to low impact aerobics, and 6 to 8 weeks before you lift anything heavier than about 20 pounds. But we do want you up immediately walking around even the day of surgery. When we do a tummy tuck, liposuction, and breast procedure together, we'll extend that out a little bit. And it'll be more like 10 to 14 days back to work in an office type situation, 3 weeks low impact aerobics, and 2 months before you lift anything more than about 20 pounds. And also, again, the day of surgery, we want you up moving around and walking, because it's really good for you to do that. Now, a lot of patients ask us, can I work from home? Can I work from home? Absolutely. In fact, we like that. We find that our patients that work from home have an easier time with recovery. And a lot of our patients will start working the next day from home. If your mind is going through, your computer out to the world and interacting, or you're on the phone. It's not focusing on that you're sweaty or sore or something itches. And so when you're occupied like that, we find that patients, the time passes quickly and they have a much easier recovery than if they do nothing but sit there and think about their surgery. And so we're all for working from home very quickly, if that's possible for you. Let's look at some before and after pictures. I think that always helps in the discussion and helps you kind of visualize what we're doing with these procedures. Our first patient here is someone who had a breast augmentation and a tummy tuck and liposuction. So if you look in the before picture, you'll see that the breasts have kind of shrunken down and are a little bit deflated. They're not really droopy, they're more deflated. We call this postpartum involution. And if we add volume back, it'll just sort of refill the breast and maybe enhance it more than it was even during the pregnancy. If you look at the abdomen, what you'll see is you can grab some extra skin and you can see that the wall is sort of distended or forward or loose. And this is because it was stretched out during the pregnancy. In addition, she sort of has some small amounts of fat around her thighs and love handles. So a tummy tuck, liposuction, and a breast augmentation was the plan for this patient in her Mommy Makeover. So she has silicone implant behind her chest muscle, just kind of pushes everything forward, restores her volume and then some, probably to the volume that she always wanted to be even prior to pregnancy. And with the tummy tuck liposuction, you can see the tightening of the skin along the abdomen, the tightening of the abdominal wall, and then a reduction of fat in the areas around the love handles and thighs. Our second patient also had a tummy tuck. And so you can see this patient has a little bit more extra skin. This is probably a more average tummy tuck type patient. And so she has extra skin. She can grab that at the bottom. She has a loose abdominal wall and a little bit of excess fat. And so if this is you and someone tells you they can do liposuction to make this go away, you need to get up and walk out. And so we see this patient right here all the time who are told by other surgeons that they can do liposuction to tighten this up. Really, Brette's heard this a bunch of times from me, but it's pretty annoying to me in our industry that would happen. And so you cannot liposuction something tight. Liposuction removes fatty volume through tiny incisions. You can think of that as deflating something. And so if you were to deflate her abdominal wall skin, then it would hang more and it would be more of a problem. And so if this is you, or your abdomen is a lot like this, liposuction is not going to be a good treatment for you. You're going to need a tummy tuck. The good news is that tummy tucks work great and they're pretty simple procedures, and they actually take less time for me to do a tummy tuck than to do a typical body liposuction. And so you can see, or you could imagine grabbing the skin on the lower abdomen, and then she's probably in her picture holding her abdominal wall in some. And we ask patients to relax the abdominal wall a lot of times in consults, and they just don't want to do it. And it's actually pretty remarkable. And I'll say, hey, loosen your stomach, because I want to demonstrate to them the laxity of the abdominal wall so they can really see why we want to do a tummy tuck. And I'll mention to them, and I'll say, relax it. And they go, I am. And it's like, relax it. And they're like, I am relaxed. You're like, no, you aren't, because you're really holding it in. And so that's a natural reaction that everyone has when they have a loose abdominal wall, is they walk around with tension on all the time. Well, we'll apply more tension for you, and it will be permanently tighter, probably tighter than it's ever been. And so as you can see in our after picture, we've tightened up the abdominal wall. It has a much more athletic appearance, better contours to the abdominal wall. And then we remove the excess skin as well. And most of the time with tummy tucks or with abdomens after pregnancy, most of the time the stretch marks are located on the bottom part of the abdomen, or most of the stretch marks are on the bottom part of the abdomen. And when we do a tummy tuck, out it comes. We remove most of those stretch marks. Also, when doing a tummy tuck, we put a 3-day numbing medicine throughout the abdominal wall and then in the skin overlying. And so that really provides a nice pain solution in addition to the pain meds that we give to allow tummy tucks to be pretty reasonable. In addition, almost always, we do not use a drain when we're doing tummy tucks. So we have a procedure that we do that sort of tacks everything back down and prevents the accumulation of fluid. And so we'll typically not use a drain because we found that they're very unpopular with patients. Let's take a look at a third patient in the Mommy Makeover spectrum. And so this also is tummy tuck and breast augmentation. And as you can see in her before picture, she really just doesn't have that much volume. There's not really any drooping. There's really not that much to droop. She probably always had smaller breasts. And so she also has sort of a different shape where the bases of the breasts are a little bit narrow. It's called tuberous. And so the cleavage is kind of farther apart. And so we could put an implant in and with that reshape the breasts, obviously make them a little bit bigger, but then kind of make the cleavage tighten up a little bit. It gives an overall better shape to the breasts. When you take a look at her abdomen, you again can see the sort of pooch on the bottom or the sticking forward of the abdominal wall. You can imagine again, also if you grab their skin excess there, maybe not as much as our last patient, but there definitely still is some there. And then stretch marks. And so with the tummy tuck, we'll tighten the abdominal wall so it's pretty much straight up and down, and we'll remove most of that lower of the skin from the pubic area to above the belly button. All of that's gone. And the skin from above the abdomen stretches all the way down to the pubic area. So also things to consider are if you take anyone who's had pregnancies and you look at the skin below the belly button, you'll see that's typically stretch marky, it's thinner, the texture is not as good, and it typically carries more fat. And then if you run your hand on the skin above the belly button, you'll see that it's smoother, it's thicker, it has less stretch marks, and it's typically thinner as well. And so we'll take the good skin from the upper part of your abdomen and use that to resurface the entire abdomen. Of course, you may be wondering where we do these consultations and surgeries. And so all of that is done within our office. And so we have about a 13,500 square foot office. Besides being a state-of-the-art office, we also have a surgery center. And so we have 2 ORs and 5 recovery beds. It's accredited by 2 different governing bodies. One's Quad ASF and the other's Medicare. Quad ASF is a typical sort of accreditation body. Medicare is a much higher standard that typically is only done in hospitals. Not too many surgery centers in California have that accreditation. And so we like to keep it. We've always had it. It's a higher standard. And that's kind of what we've tried to target all these years. And so we're fully accredited. We use an anesthesiologist. For all of these procedures, you would go to sleep. We think it is safer for you to be asleep, comfortable, not moving during these types of procedures. To me, the scary thing is to be an in-between state when you're having these types of surgeries. And so all of our patients go to sleep because we want you comfortable and happy, and then you wake up and go home afterwards. Well, Brette, do we have any questions for tonight?
Definitely. Let's start with Emily. She says, I have 2 kids, 2 and 4. I'm thinking about surgery, but I'm not sure if it's too soon. Am I even a good candidate for a mommy makeover?
Potentially. And so it'll start with a consult. And you're a good candidate for a mommy makeover if you have aesthetic and potentially functional concerns with breast and body. And so if you have that loose skin or loose wall, or you want to change your breast shape or size, or you have some unwanted fat, those types of things would make you make a mommy makeover maybe a good idea for you. So we will review those things. As far as distance from pregnancy, at 2 and 4 years old, you're perfectly good. And we absolutely can talk about doing something for you.
Great. Jessica asks, I want a mommy makeover, but I might have another baby in a year or 2. Is it worth doing now or should I wait?
That's a great question from Jessica. So the question is, if you're going to have another baby, should you do a tummy tuck? And so I'll answer really two questions in that. You had mentioned if it was a year or two, and I'll also answer if it's, a longer period of time, like maybe 10 years. And so, and that'll help explain it. We oftentimes have someone who had a baby at 18 or 19 years old with significant changes in their abdomen. They'll then come to us in their early 20s and say, I want to do a tummy tuck. And because they're so young, we'll counsel them, if you have another child, you may be stretching this out. And the reply might be that, well, I'm going to have more kids, but it's not going to be into my 30s. And so I would like to have a flat stomach for the next decade before that happens, because I really don't want to live my 20s with this extra skin. And that is a totally reasonable position to take, with the idea of having this procedure, knowing that at some day you're going to stretch it out. You probably wouldn't stretch it out as much as before the tummy tuck, but you still potentially could stretch it out some. As you shorten the timeline down, it may become less of a viable procedure for you. For example, you may not want to do a tummy tuck and then get pregnant a year later, but 6 or 7, maybe you think about it. And really that's kind of a personal decision. So if you're imminent to have a pregnancy, or you're going to be doing it in a short amount of time, we'll suggest that you wait. But if it's going to be a longer period of time and you're okay with potentially needing a revisional surgery, then we can go ahead with the procedure.
I think Rachel has a good question here. I just had my baby 6 months ago and I'm still breastfeeding. How long do I need to wait before I can have a mommy makeover?
Great question. One determining factor would be if you're having a breast procedure. If you're having a body procedure, we'd be able to go ahead and proceed. And there's things we can do around breastfeeding with surgeries that make it okay. If you're going to have a breast procedure, we want you to stop breastfeeding for about 3 months prior to surgery. The reason for this is you could think of your breast if you held a cluster of grapes. The grapes are the little factories that make milk, and the stems are the ducts that would carry that milk out of the breast through the nipple. And so if you cut through those stems during the surgery or cut through the grapes, then they would release the milk into the breast as opposed to out the duct system and out the nipple. And that means you would collect milk inside your breast. It's called a galactocele. And so we don't want that to happen. And so what we do is we allow 3 months to pass from the time breastfeeding has stopped. And that allows all those lobules to sort of turn off their milk production. And then we feel safe working on the breast or making an incision in the breast, and that a galactocele wouldn't happen.
All right. I have another one from Sarah. I've got a 3-finger gap from diastasis recti after 2 pregnancies. Will a mommy makeover help fix that too?
So let's talk about diastasis recti, which is this term or medical term for loosening of the abdominal wall. A long time ago, insurance would cover tummy tucks if you had the right diagnosis or diastasis recti. And so there was a lot of abuse of tummy tucks because patients were going to their family practitioners and looking for referrals with a diagnosis of diastasis recti because they potentially could get their tummy tuck covered by insurance. That game was played a long time ago, like back in the 70s and 80s. Since then, the insurance companies sort of wised up and said no more. And they don't really recognize that as a treatable medical problem for the vast majority of patients. And it's probably appropriate because it was really sort of an abuse of the system that was done a long time ago. But the lore of medicine, and really out with a lot of our referring physicians, that term diastasis recti has been passed on and on and on and on. And patients oftentimes are afraid when they come in, they talk to us, and they present this grave diagnosis to us of diastasis recti. It's like, oh, my doctor said I have diastasis recti. Am I going to live? Or and they're super concerned about it. And really, it's pretty simple. If you have pregnancies, you're going to have a loose wall. You might have a little bit, you might have a lot. Most people are going to have at least some. And so having a loose wall after pregnancies, or really a weight loss, is an expectation. And so it's not a grave diagnosis. It's nothing to be afraid of. It's literally just a loose wall. And so that's what tummy tucks work on, is tightening that up. And whether you can put 3 fingers or 1 finger or 8 fingers, if it's loose to you, and we can really tighten it up. And so I kind of try to caution patients and try to keep them from being scared about that, as if they have some grave diagnosis. Now, interestingly, when you tighten up the abdominal wall, you make the core stronger. And so you can imagine a muscle being something that pulls 2 things together, right? Attached to a couple bones. And when the muscle contracts, the distance shortens and those bones get pulled together. And for your abdomen, ribs to your pelvic bone, it would pull you like in a crutch. Okay. So if your wall, or if your wall is stretched out and your muscle is doing a curve rather than a straight line, and it can contract, as it starts contracting, it really just pulls the muscle straight. And once it's straight, it pulls the 2 bones together. And so you lose a lot of your muscle function by just getting it to the point where it's straight. And then from there, you have whatever's left. And so you really lose a lot of the efficiency of your actual rectus muscles. When you tighten up the wall and sort of realign those muscles, as they contract, they immediately start pulling the bones. And so the same muscle with same strength does a lot more work once we straighten it out. And once it can do more work, it's therefore kind of stronger. And then that helps balance out with your back and provides you a stronger core. And so that's sort of one of the side benefits of having these procedures, is that it can improve your core strength by making your muscles actually work more functionally.
All right, here's one from Lindsay. My breasts are droopy and I was told I can get implants.
Well, Lindsay, yes, you can get implants, but that's not a correction for being droopy. So implants make you bigger and lifts make you higher. And it's funny because we hear this all the time, is that patients will tell us, I went in and told them I was droopy. They said the only way to fix it was an augment. And now I'm big and droopy, right? And then they'll want a correction of that. And so if you're droopy, you're likely going to need a lift. If you put an implant into a droopy breast, you have a bigger droopy breast. And so it's very important to keep those things in mind when you're doing your consultations in making a plan for surgery. Implants make you bigger and lifts make you higher. If you have deflation with no drooping, an augment is fine. We showed you an example of that earlier. But if you have drooping, you're going to need a lift. And if you try to do an augment in place of a lift, you're doing one procedure that you don't need and forgetting the one that you do, and you typically won't have the result that you're looking for.
The next one is from Megan. I work out 4 or 5 times a week. How long until I can get back to exercise after the procedure?
Typically what happens is you'll sort of take it easy for a few weeks after the procedure. Certainly can get up and walk around and maybe even go for some short walks. But at 2 or 3 weeks, we can begin low impact aerobics. That would be things like brisk walks, gentle on an exercise bike, maybe uphill on a treadmill, keeping it super low impact. But you can kind of get the juices flowing, your blood flowing, and your heart rate up a little bit. We won't want to begin more rigorous exercise for 6 to 8 weeks, depending on if we do a tummy tuck, a little longer, if so. And at that point, we'll increase as tolerated on athletic activities and or lifting of objects.
Here's one from Amanda. Can I just do liposuction without the tummy tuck? I don't think I need the full makeover, but I want more shape.
So absolutely, there are plenty of times that we do just liposuction. And so it depends on what you're looking for or what your concerns are. If you have a loose wall and loose skin, liposuction is not going to be your friend. Liposuction would actually make the skin more loose and wouldn't do anything for the wall. So if your wall is in good shape and you don't have skin excess, liposuction is a fantastic option for you. What we find is that patients think a tummy tuck is a huge procedure and liposuction is a very tiny, easy procedure. And there's a lot of anxiety associated with tummy tucks, and liposuction is just like buying a pair of shoes or like a nothing. And so that's actually not true. They're both similar types of procedures. They just do different things. And so many patients will come in and say, can you liposuction away all this extra skin on my abdomen? Answer is no. Like, you need a tummy tuck if you have that laxity. But if you don't have laxity and your abdominal wall is good, absolutely, we can do only liposuction.
Christine wants to know, is this done all at once or are the procedures spaced out over time?
Typically with these mommy makeovers, which would be breast and body procedures, we're doing it all at one time. The only reason we maybe wouldn't do it together would be sort of special circumstances with either a very involved procedure with someone or a very big procedure where we were worried about doing too much at one time. But the vast majority, more than 95% of the mommy makeovers, we do all at one time.
All right. Taylor's question, are the results permanent or will I have to redo stuff in a few years?
So no aesthetic procedures should ever really be considered permanent. I can tell you some characteristics about them. If you keep your body weight stable, a tummy tuck and liposuction procedure is a very long-lasting procedure. And so the way someone would make it not last so long is a lot of weight gain. And so if you've ever heard someone say, oh, don't get liposuction, it just comes right back, that you could translate into the statement, I had liposuction and gained a bunch of weight. And so if you stay stable or even remotely stable, that result will stay with you for a long time, and your abdomen will probably be tighter than, it'll for very long decades. With breast procedures, we don't anticipate having to redo them every few years. The FDA recommendation on implants is replacing them every 10 years. That's a guideline from the FDA. Many of us think that they can last longer than that. And then there are patients that come in prior to that because they want to change their size or have some recur on drooping. With respect to longevity of breast procedures and lifts, that is kind of a little more open, meaning it really depends on your elasticity and skin of your breast. There are some patients that have really good skin tone. You can put an implant in or maybe do a lift, and it stays like that for a long, long time. And there are other patients that have really poor skin elasticity. It's very stretchy, kind of very floppy. Those patients will tend to stretch out a lot faster than those that have really good skin tone.
One from Olivia. What if I gain or lose weight after surgery? Will it mess up my results?
Great question. And it really depends on how much weight gain or loss that you have. If you're gaining and losing small increments of weight, it's probably no big deal. If you gain and then lose a large amount of weight, that is a setup that puts you in the category of a tummy tuck to start with, adding the volume of a baby and then removing it, or gaining a bunch of weight and then losing it. So you would stretch out your abdomen and then shrink. You shrink back down, your abdomen doesn't shrink all the way with you. And so it's possible with a large weight gain and loss that you would loosen things up, probably not to the point that you were loose before the surgery, but it may loosen it up some.
All right. Jasmine asks, can you finance this? I'm ready to do it, but I need a payment plan to make it happen.
So if you were to ask me that question, I would politely refer you over to Brette because she handles all those types of questions for me.
Yes, happy to answer that. Of course, you can finance. I can definitely help you with that. We do have some finance options on our website. Let's go to Nicole's question. Do I need to lose weight before getting a mommy makeover, or does that not matter as much?
Good question. And it really depends on where your starting point is. We see a lot of patients that have lost a lot of weight on their own and come in and think they need more weight loss because of the hanging skin, but really they're just ready for the procedure. So let's take a tummy tuck, liposuction, augment, lift, which is kind of like a very common mommy makeover. If I look and there's more fat that I can remove at one time, then I might tell the patient that, I really can't suction out all your areas of need. You might want to consider losing some weight first, and then we do the procedure to get you the optimal result. But most of the time, and the patients coming in, we're pretty good to go right from the get-go, and they won't need to do any type of weight loss prior to the procedure.
Next question, Allison, I really don't want to look fake or done. Can I still get natural looking results?
Absolutely. Very possible. Usually when we talk about looking fake or done, it refers to face procedures. And so it's something super important we talk about all the time. But with respect to breast and body, it typically refers more to the breast. And what that I think refers to is whether or not we're doing a proportional type implant. And so there are ways of making breasts look natural, and there's ways of making them look unnatural. For me, I think we need to put the implant under the muscle. That gives you the maximum amount of coverage over the muscle, and it helps disguise the implant and doesn't have that sort of stuck on look that I'm really not a big fan of when you put it on top of the muscle. Next, and super important, is what is the shape of the implant we put in and its relationship to the chest wall. So you can look at the chest wall or the hemi-chest wall, which is one side, and you look where the muscles start on the sternum and ribs, and then where the outside of the body is. And so the muscles can start kind of far apart or close together. And so we can really see that during your exam and know about how wide you are. So when I'm doing a consultation with someone, we'll look at some pictures and pick a proportion. And then I'll match that implant, that proportion to the size for their body. So each one is customized for each particular patient. One thing you don't want to know is all your friends' sizes or look at numbers on the internet, because we're going to customize it for you and your body, and it will be different for someone who has a different size or shape body. And so that's really key, is like we try to delete all that information of numbers and things and go by what you look like to help pick the right implant size. Once we pick the right size, we'll pick a profile of implant that will match up with your chest wall. And so you want that to go right from those muscles to the side of your body. If it's too wide, then it will stick out the side, kind of get in the way of your arm, and look more unnatural. And so that is what an unnatural breast augment would look like. But that can also occur if the implant's too small or too narrow. And so the implants naturally sit down and out, so in the bottom corners of your chest, and they'll go upwards the diameter of the implant. So as you reduce the diameter of the implant, because they're sitting out wide, the cleavage will just get wider and wider. So you want to have an implant that spans from the side all the way towards the middle. And if you match that up, it looks very natural. If you're too small, the cleavage will look really wide. And if you're too big, it'll stick out the sides. And so, yes, there are ways of making them look natural. And that's one of the things we talk about during the consultation.
Thank you for all these great questions. This is our last one that I have, which might be my favorite. Susan asks, okay, be honest. Do you offer a, quote, grandma makeover, unquote? Go ahead.
So that's a great question, the grandma makeover, and certainly like more talked about over the last few years. And so yes, we can do grandma makeovers, but where the Mommy Makeover talks about breast and body procedures, usually the grandma makeover is a little more wide open. The grandma makeovers a lot of times just involve doing face or face and a breast lift, and so there are just different combinations of things that we can do for grandmas to make them look and feel just great.
Oh, that's good. Okay, that was our last question. But if you need any help, you can email me at info@blackhawkplasticsurgery.com or call our practice at 925-736-5757. Also, if you're interested in scheduling a free consultation with Dr. Ronan, we have easy-to-use online scheduler. You can scan the QR code on the screen or simply visit blackhawkplasticsurgery.com and click on the scheduling link. Thank you all for attending. Good luck with your mommy makeovers. And back to you, Dr. Ronan.
Well, thanks for tuning in tonight to BPS Live. We're really happy to be here. Brette is looking like an absolute professional broadcaster again tonight. Yeah. And I didn't get my makeup done as well as her. And so sorry you had to look at me, but we're happy to be here. And we'd love to see you next time at BPS Live. Thanks for tuning in.
Bye-bye.